The most important, not the most, but important thing to remember, your blood and your lymph technically sterile. Well, not tech. If they are normal, they're sterile. There are no pathogens. There are no microbiome in the blood or in the lymph. The problem with circulatory system, it's a perfect transport route for the infection to reach each and every corner of your poor organism. Okay, so if infection goes into the blood, it goes systemic, right? It can reach everywhere. Same goes for lymphatics. If it goes and it, well, if it goes into the lymphatics, it can either be stopped at the level of lymph nodes by macrophages, for example, or it can drain into the blood and become systemic. So again, it depends. Presence of infection in the blood is called emia. Okay, viremia, bacteremia, fungemia, and blah, blah, blah. If bacteria starts to grow, it's called septicemia. Bacterial growth in the blood causes a massive immune response. And then that disproportionate immune response, imagine systemic inflammation all over the body, is called septic shock. It can be associated with the hemorrhages in all organs. It can be associated with vasodilation and drop in the blood pressure. It can be associated with the disseminated coagulation in the smaller blood vessels and cease of the blood flow. So there are multiple consequences, usually pretty bad. Okay? Yes?
So is that like Ebola?
Uh, yes and no, because in case of Ebola virus, probably most of the damage was done by the patient's immune system. It did cause the high permeability of the capillaries, local hemorrhages, but the main cause of death in Ebola was dehydration. Yes, the lack of the basic hospital supplies, like the IV lines. You cannot fight dehydration with just giving water to unconscious patient. Okay, so they had to have IV lines, and there were just not enough IV lines. It pretty much no infrastructure. Okay, lymphatic system is supposed to fight infections, and it does so, but can serve to spread of infection as well. So when infection enters the circulatory system, the first organ of circulation that comes to mind is the heart. So in case of heart, it has three anatomical layers of the wall. Endocardium, which is the layer of endothelial cells. You can see that white line here. Okay, endocardium, myocardium, which is the muscle, and pericardium, the fibrous tissue that surrounds the heart. So inflammation of this, the endothelium, okay, can you please open? Thank you. Look itself, thanks. So inflammation of endothelium of the heart is caused endocarditis. Now what you have to appreciate, inflammation of endothelium in the heart is bad, but the worst thing is that the infection can spread all the way to the valves. And when valves get infected, the inflammatory response leads to the formation of so-called vegetations on the valves. These vegetations impair the valvular function, impair the ability of valves to regulate the blood flow between the chambers, may cause valvular stenosis, okay, regurgitation of the blood. The two main causative agents of endocarditis, of the valvular vegetations, are Staph aureus and strep pneumonia. We can also add technically strep pyogenes Okay, in some cases, gonorrhea, systemic gonorrhea can cause endocarditis. So strep pyogenes actually causes strep pyogenes and strep pneumonia, both respiratory pathogens. When they spread to the heart, they cause what we know as rheumatic fever. Okay? We refer to it sometimes as rheumatic fever when valves become affected. As with any infection, you have a fever. Patients may have anemia, an abnormal heartbeat. Now, the acute endocarditis with very quick onset requires a surgery in most cases. Okay? The subacute, they both require, of course, treatment with, if you look at this nafcillin or oxycillin, they both, vancomycin, both focused mostly on gram-positives, while gentamicin is the broad range antimicrobial. Now, in both cases, the surgery may be necessary. The difference between acute and subacute is the time for developing the full-blown symptoms. Does that make sense? But keep in mind, staph and strep, staph aureus and strep infections are the major causes of endocarditis. That's why people, doctors, they are very active on treating things like strep throat because the complications can be really, really bad. Now, myocarditis, infection of the myocardium. You see, the muscle. Now, there's so many of them. I'm going to highlight the key ones that you have to focus on. Well, first of all, when muscle gets infected, there's an inflammation. Inflammation leads to the repair. Repair is done via connective tissue. Can connective tissue contract? No. So cardiac function decreases, deteriorates. That may lead to actually congestive heart failure eventually. And one of the leading causes of infectious myocarditis is the Coxsackie virus, named after the town of Coxsackie in the New York State where it was discovered. Other viruses are associated with it too, like these ones, but Coxsackie by far is the major viral cause of myocarditis. Bacterial causes include Borrelia, which is the causative agent of Lyme disease, Corynebacterium diphtheria, which is causative agent of diphtheria, so it's a complication. Haemophilus influenza can also be, but Borrelia is probably the most frequent cause of bacterial myocarditis. So you see, if you leave bacterial infections untreated, that may lead to the complications, systemic complications, involvement of different organs. Fungal infections, the Aspergillus, sometimes can be found growing as the mold, the attics, okay, around the railroad tracks. The infection itself is not very frequent. People can inhale it, okay? And if people are immunocompetent, probably the fungal infection will not occur, okay? But in an immunocompromised patient, a fungal infection can actually affect the heart. Parasites. Now this is interesting. So Trypanosoma cruzi is the relative of the, so this is the South American infection that is known as Sharkus disease. Have you heard of it? No? Anyone ever donated blood? You have to answer a question. Have you ever had Sharkus disease? Okay? If you ever had Sharkus disease, you are deferred for lifetime from donating blood. Because probably parasite resides in your blood. You cannot completely cure it. There are effective drugs, but you can't get rid of it entirely. That makes sense? Ascaris lumbricoides. That's the intestinal worm. It's a helminth. Normally it resides in the intestines, sorry. Normally it resides in the intestines. Okay, okay. It resides in the intestines here. Okay. And it's bad enough in the intestines, but if it migrates, if its larvae start to migrate out of intestines through the tissue, it may end up in various organs, including the wall of the heart. And there it just pretty much eats its way through the cardiac muscle. Just pretty bad. Trichinella spiralis is an interesting worm that is also a nematode. So they're both nematodes, Scarus lumbricoides and Trichinella spiralis. This nematode is very, very small, like really small. We talk about maybe maybe an inch. It develops, the larva infects and develops in the muscle cell. And believe me, cardiomyocytes are perfectly fine for development of trichinella. So patient with progressive trichinellosis may end up with the trichinella larvae sitting in the heart, and when it is in the heart, it kind of forms sort of the tubercle, okay, the granuloma in the heart, which impairs the muscle function, causes inflammation of myocardium, and impairment of the heart function. Now, treatment, whatever antimicrobial is required, although it takes a lot of time, and essentially you have to treat the resulting condition, which is often cardiomyopathy or congestive heart failure. Does that make sense? Okay. On Thursday, we're going to see if we have any contamination ever.